going to go to the mental health and sports injury, which we're going to have Coach Marcus Lewis and Dr. Rachel Turk. All right. Mental health and sports injuries. First question, how does mental health issues such as anxiety or depression affect athletes' recovery from injury? You want to go, Doc?
Sure.
Okay.
Well, I think if you look at the different symptoms that have to do with both anxiety and depression, they have to do a lot with the recovery of a student athlete. So, for example, in those things, so you're feeling difficulty with sleeping, difficulty with appetite, you might have low motivation, low energy. So if you're thinking about the folks that have already been up here today, the things that are important for that student to work through a recovery process, all of those symptoms are going to get in the way. Not to mention after an injury, when a student goes through that, it does tend to be a higher period where we see those numbers already increase naturally because you've all of a sudden taken away maybe the identity of that athlete. You've taken away the mobility of that athlete. So somebody who's typically hyper able, like super able bodied, able to get around anywhere they need to do anything for themselves, all of a sudden now need a lot of assistance and help. So we're taking away a lot of things from them and a lot of coping skills they typically had, and then also increasing the symptoms they might be experiencing at the same time. So it's kind of like a perfect storm of things happening that get in the way of recovery after a pretty serious injury.
I mean, you kind of touched on everything just now. From me, I mean, it's just like what you said, and I've been going through it all year as far as being a high school football coach. Several injuries. Dr. O been seeing a lot of my players, and it's definitely been a thing to where we have to stay on them to make sure that they do everything they're supposed to. They lose focus on the task because they mentally are drained. They're used to playing a lot. I've been coaching for a while now. The past several years now, we had several injuries to where having a Dr. O and different people like that I could call, and we actually have a doctor on staff to where it's been helping our kids just stay on track by just the communication, being on the same team. But it's definitely a tough thing for these young athletes just to remain focused for they can get back on the field.
Okay, good job. Question 2. What are some strategies to support an athlete's mental well-being during the recovery process, especially for those who may feel isolated?
I'll start again. Just having a plan. When we have that plan, for me, having a plan and we sticking to that plan, especially when you're trying to got 50-something kids on the team, having a plan for that one athlete to where I have several other coaches to where we try to execute that plan. So, for example, if we go in the weight room and we got a kid right now that got a shoulder injury, can't do everything else the kids do, we have a certain coach come in and just try to focus on that plan so that way we can get them back on the field, from icing, from bands, just from everything.
Yeah, and I would say, social isolation is huge because, again, they've lost their teams. They often can't be at practice at the same time. Maybe they're doing their rehab stuff during practice or during a lift. They're limited in what they're able to do. And so in particular, I'll talk with my athletes about how do we get you more involved in different things. Maybe you aren't mobile on the field, but can you be timing for your coaches? Are there things you can be, serving in a role as almost like a student coach in some way to get you involved with that, the things that you can be doing, watching film, studying, your different playbooks, whatever it is. So I think those are all big, but then also just how we're building their social supports around them outside of sport. So a lot of times sport for elite athletes takes up the most of their day, the most of their time, and that is who they're spending all their time around. But when all of a sudden all their teammates are doing the things that they aren't able to do, we got to build up who else they're spending that time with, who else is supporting them, who's helping them, in my case, get across campus, get to a meal, maybe carry their tray in the dining hall because they can't always do it for themselves. So building up all the social supports, not just the athletic ones. and yeah, just being involved in the ways that they can and trying to build themselves up and in mentally ways that they can in the process.
Okay. Number 3, how important is it for medical teams to assess and address the mental health of athletes as a part of their injury recovery plan?
I would say it's pretty critical. I'm a psychologist for an athletics department, and so in my role, I don't see the student athletes until they're referred to me by their medical team. Now, we have a system in place where every one of them gets referred to me after a season or career-ending injury, but that's not the case everywhere. And we know that these mental health issues increase after an injury. So the medical team typically are the ones seeing them regularly. Our athletic trainers are seeing them every day of the week. So it's them seeing and noticing something's going on, or even later on in the injury process or recovery process, seeing like that fear of re-injury that's keeping them from making certain movements that maybe is how they got injured in the first place, and how we might work through the mental pieces of it. So the teams that are around them every day, those medical providers, are the ones typically seeing them way more frequently than I will ever see them. So I think it's critical.
I mean, I definitely agree to that. As far as on a high school level, it's totally different just as far as how we go about it and the support. For the younger kids, we come from a different support because we dealing with behavior, we dealing with making sure grades. It's just a lot that we got to go through to get them remain focused as far as from a mental health standpoint. From family issues as well. I mean, it's just a lot. Like right now, we got 2 kids. One kid was injured. The other kid dealing with some family issues. Parent got cancer. So when I tell y'all, it's a holistic approach for us as well. Just making sure they got the backing and the support outside of football, from the medical side, from the behavioral health side, and from the school system side.
Okay, good job. Question 4. Can you talk about the relationship between long-term injuries and the identity crisis for some athletes face when they are sidelined from their sport?
Repeat that one.
Okay. Can you talk about the relationship between long-term injuries and identity crisis for some athletes that face when they are sidelined from their sport?
I'll just start. I think they lose the identity, especially when they realize that, depending on what injury is, to where, matter of fact, our DN this year, which was our best DN, second scrimmage game, he tore his ACL. So right now, he was just trying to find himself. A lot of things for our kids, especially on the east end of Eastern Henrico, football or sports is our way to go to college. So right now, he's just trying to figure out, is this something that he still want to do mentally because he's just drained. But once we put a plan in the process. I reached out to some college coaches to where he's still able to get recruited. I think that helped him just find himself and let him know that, outside of football, as long as you got your grades and things like that, we still got a plan to go to college. So that was the biggest thing I see with the younger kids.
Okay.
Yeah, I mean, I definitely agree. For elite athletes, being an athlete has been a part of their identity for most of them most of their lives. So when that's ripped away from them suddenly, it's not even like you see the end of your career coming, it's happening. You're able to start to prepare for that, even though that's still a transition. And instead of that, in an injury, it's just gone. I had actually one of our injury appointments in the past couple of weeks say to me, like, yesterday I was moving fine, and today I can't even walk without crutches. So it's just such a sudden change for them. And the athlete piece of it is obviously huge. Their support system, their teammates, who they're around. Like I said, a coping skill. A lot of times sport is something that makes them feel confident, and maybe the only thing that makes them feel confident. And so they've lost that. And then, on the other side of their just physical ability, their way to do things the way they're used to, they can't necessarily shower on their own or eat on their own. So many pieces of it to where, part of what we might have to focus on is what are the other pieces of them that really matter? What are the things they can tap into right now? So whether they're returning from this injury or not, we have to figure out where can they build their confidence, where can they find their sense of self, how can they still be themselves, even if sport isn't a part of that right now, or how can they be involved in sport in any way that they can, if that's what they want at that time.
Okay, good job. Question 5. What are some signs that an athlete may be struggling with psychological aspects of an injury, and how should it be approached?
Well, I think everybody in this room probably knows there's a lot of signs when someone can be really struggling with the psychological parts of injury. And those may be things like the physical symptoms. So they're struggling to sleep at night. They're struggling to eat how they would regularly eat. But also, you can see it in the way they might carry themselves. You might see it in, again, their confidence levels. It can come down to how motivated they are, if they still are even going to classes or getting their work done, or, even then they're having trouble paying attention or focusing on different things happening. So I think there's a whole range of things we want to look for. A lot of what I might look for is how they are engaging in their recovery, how motivated they might feel when they're working out and doing the small steps, or if they're really struggling to feel that motivation to even go to their appointments, if they're missing appointments. I would also look for how they're doing in every other aspect of their life. So I think the holistic approach you said earlier, are they just avoiding everybody? Are they staying to themselves? Are they not talking to family about it? Are they holding all those emotions in? Because I think for anybody going through that type of injury, there are a lot of emotions. And I think in particular for our male athletes, they're not always supported in expressing all the different emotions that might come up. So, I know a lot of our guys that are kind of trained their whole life, like they can be angry, but they can't be sad. So they can be angry about this injury, but they're not allowed to cry about it. They're not allowed to be upset about it. So helping them to also tap into some of those pieces, or notice when they're not tapping into it and that's starting to affect them, because all of a sudden you're seeing emotional outbursts. You're seeing them show up in ways that they're not usually showing up. So I think it can range from just about anything.
You said it all right there. Honestly.
Okay, no follow. We can go to the next question. Number 6. How can coaches and teammates help create an environment that supports athletes who are dealing with both physical and mental challenges from injury?
From a coach's standpoint, just figuring out other ways they can help the team and help themselves by having them staying engaged. Like for now, some of our kids are injured. I have them helping out from practice standpoint, from helping out on drills, helping out just doing the game as far as just recording, as far as being water boy, just whatever we can do to be part of a team. Because like I tell them, everybody has a role. And your role may have changed, but as long as you got a role, you're still part of this team. So we need you to show up and be happy about the situation. And that's pretty much what we do. Players too. I just try to get our players just to encourage their teammates. Like, hey man, just keep doing the things you need to do to get back on the field. If you can't get back on the field because it's a season injury to where you just done, just remain on the team. It's little things that we had them to do, like turning in reports weekly. So they got to still do that. We still do grade checks. So it's still a standard that we set, no matter if you can play or not.
Yeah, I think engagement is huge. So ways that they can be involved, if they're able to be out at practice, what can they do at practice to stay engaged? I have a lot of them do visualization, mental reps. So you're at practice, you're watching somebody in your position. How do you watch them do it correctly? How do you then visualize yourself do it correctly? And then maybe they didn't do it correctly. How can you make the correction in your own mind? So, and that can be at a practice, that can be during film. We'll have them do things like that. But when our coaches are encouraging them to be doing those different things in practice, because we have a range of different coaches and how involved they want our student athletes to be when they are injured. So some of them are like, don't even show up to practice, like take care of yourself, get your schoolwork done, which in a lot of ways can be really supportive, but also isolating even more. So we have some coaches that, are having them serve in different roles with the team to help out in the ways that they might be able to. So I think that's a big one for coaches. And what I found too is like, coaches checking in on those student athletes besides just sport, and that's before and during and after an injury. So how much are those coaches getting to know what's going on? How are they doing in all the other areas of their life? It might be something as simple as like a ride across campus, or, just like making sure they have a meal. The same for teammates. I think a lot of it's just being around them. I hear a lot from our student athletes. I don't want to be a burden on anyone. I don't want to ask for help. So, students that will just stay in their room instead of going across campus to get food because it's too much. But having teammates, roommates that are willing to pick up something for them when they come back, and just offering the little things when maybe people that are typically very, very self-reliant and independent and used to doing things on their own won't ask for the help with it. So those are, I think definitely things that teammates and coaches do that can be really helpful for somebody that's injured, depending on, what situation they might be in. But the engagement, the staying involved, the checking on them as more than just an athlete, but how are they just doing, and helping with the little things in life that they're not used to needing help with.
Okay, good job. Question 7, which is the last question. What resources or programs are available for athletes to address mental health issues during or after their return from injury?
Go first. Pretty different on your level.
Yeah, I would say it's probably very different. And I get a lot of emails from families in the community that really don't know what to access. And in what I've looked into, there's not always a lot that's already pre-set up for them. Like, you can get involved with things, you can reach out to different clinicians that do it, or mental health providers, whoever it may be. But I think, in the last session they were talking about like that team approach and everybody communicating. I'm fortunate that I work in an environment where I can talk to our team docs, I can talk to our athletic trainers, our coaches. Now, not necessarily about what they're coming in to talk to me about because of confidentiality, but I can at least get the base information of what they're struggling with. Whereas if I, outside of this, I'm working with someone, and they were to ask the same questions, I don't have the connections to all of those people in their life to make sure that things are going the way that it needs to be going, or, even like most of those people can't always access resources. So that's something that I've heard is a frustration of, especially like high school age parents, that their kids are going through some type of injury, is like there is really nothing in place. And even at the university level, I think this is something like we put into place when I came at Richmond, was our whole sports injury clinic that involved this check-in appointment, and keeping track of student athletes with season or career-ending injuries, protracted recoveries from concussion, any of the stuff that's going to keep them out for a long period. But a lot of universities don't even have that type of system in place yet. A lot of those places don't even have a mental health provider in place yet.
Wow. For us, or for me, it's a little bit easier because I own a behavioral health, mental health services. So I have several resources from a high school level. So we have like a resource center for our kids. So I believe in the village at Verona. So our parents know anything that their kids dealing with, or if they dealing with anything, we have resources to where I got like a book of different providers. We got mentors. We have a thing we call barbershop talks, where I have some of the kids come, and you'll be amazed how some of these kids actually be looking forward to go back to it. And just speaking about their life. It's a lot of things that I don't get to know about, just at football practice and stuff like that. So we do a lot of stuff outside of football just to build that relationship, for they will be comfortable to have those mental health conversations and let us know what's been going on, whether it's, good or bad in the household, community, or at school. So for us, and I can't speak on area high school, but just for me being in this field for over 16 years, it's just been a little bit easier because we got the resources because I've been in the field so long.
Good job, guys. That ends the questions for the panels. So I want to turn again to the audience here. Anyone has any questions for? Go ahead.
Yeah, so maybe one or two things if you have kind of an anxious athlete dealing with, something tricky. Is there one or two things maybe that you guys have done as like a system with your people that you feel like, especially in today's era, phones, everything, that it can make a quick difference?
Well, so I would teach all of our student athletes deep breathing, which I think gets a lot of eye rolls from folks a lot of times. But what we know about if you do it in a certain way is that you actually then can control your heart rate. You can also control the neurotransmitter that has to do with anxiety, how quickly it's being released into your body. And so for, an athlete that's experiencing heightened heart rate and even panic symptoms, racing thoughts, all of that, being able to slow themselves down and feel in control of that, I think can be pretty helpful. But I would also say one big one I've been using for our athletes that are returning from injury and have a lot of anxiety about the return process or what step they may be taking next, I use a lot of visualization. And so if they're about to do running at 50% speed and they haven't physically done it yet, we are going to sit down and I say visualization of we do it in a very specific way. We build up each one of the 5 senses first, make sure they can create the picture so it almost feels like they're there, let themselves walk through it from basically their feet all the way up to their head, what their body is doing, what is happening around them. And then we have them visualize themselves doing it before they ever physically go do it. So sometimes, because what that can do, there's studies out there that show a group that weightlifted, didn't weightlift at all, or visualize themselves weightlifting. Actually, the group that weightlifted increased the most amount of weight they could lift. The group that did nothing didn't. And then the group that visualized it increased the amount that they could lift without ever lifting a weight. And so I talk to them about that study and I talk about the power the brain has to build their confidence and build their muscle memory by just visualizing themselves doing it correctly with correct technique, their body's doing it in the right way. And so the more they use that visualization in that process, the more I see their anxiety go down to be able to take that next step. And sometimes I'll even have them kind of like in the moment, if they're on a field or on a court, go sit on the court and do it. Like go out to the field and do that so you're actually surrounded by the environment and you can take all that in. It's a little easier than just having to like remember everything or recall everything from memory.
Another thing that we kind of do too, like when it comes to certain things, I just kind of let our athletic trainers handle things. But we're big on meditation as well. It's what we do group to get their mind right, whether it's returning to the field, just anything. I think, like you said, when you program your mind, the mind is a powerful thing. So for us, we've been doing meditation and we've been doing yoga just to have them relax and let their body just get comfortable, things like that.
Any other questions? I think I might have one. Rest based off what you said. Would that be ideal to see more at the high school level? To see where maybe sometime during their practice, and I think that may be facilitated by the athletic director or coach, but you can actually have more of a meditation time or downtime for athletes. Not so just, that some days you gotta have like weight training. Some days you may have where you just run, and some days you just do walkthrough. Is it possible to kind of implement something like that?
Absolutely. And I think meditation and anything around teaching the athletes to train their brain. So meditation, mental performance skills, all of the above. And you can do some of that in 5 to 10 minutes. So I think that's the thing we might try to convince our coaches of is like, if you can give me 5 minutes before practice. And actually there was a season with our football team that I came out while they were on the field, while they were in their lines to stretch, and we did a skill. You get 5 minutes, we do the skill, you practice the skill, and then I'm around at practice and you can come up to me and talk to me about the skill. So whether that is how to change the way that you're thinking, your self-talk, whether that is being able to sort of slow down that anxiety that's happening. Now that's not obviously something that can happen everywhere, but I think if we did have more of our youth learning how to control that anxiety when it comes up, how to control their mindset, the way that they think, train their brains. I tell our athletes, you're training your bodies 20 plus hours a week. How much time are you spending actually training your brain? And your brain is the thing that's making your entire body do what it does. So why are we not, all the high performance, pro levels have people doing this with their teams. Why are we not integrating it in at a younger age? Because that then allows them to not only do that in sport, but it allows them to do it in life.
Yeah.
So, no, I agree with everything you just said.
Okay.
Yeah, and for us, we actually do have the time. So for me, I try to outsource things that I don't feel like I'm a professional at, to where we have, like I said, mentoring groups, somebody that can specialize in meditation, We got a yoga instructor at the school, so I kind of use my resources to have them come in. Like today, we had practice. We lift, we do yoga, and then we do meditation as well. I didn't go, but that's some of the things that we do. Yep.
Yeah, I would like to see that because I guess now being in the media part of it, the media is actually covering a lot of the youth sports now, especially, middle school level, either the really youth level and especially high school where the kids have more access. You have full access to everything now in sports where we didn't have maybe 10, 15 years ago now. And every time, like, I think Chris, you alluded to it earlier where everybody's about, I'm blessed to receive this offer and everything like that. And if these kids, if they don't get it, it's like the end of the world to them. And so now I just feel as though that something like that would be nice to see because, like you said, you can't get it at home. You never know what the situation may be or what's going on behind the scenes with a particular athlete and what they have going on at home. Could be cancer or anything going on with behind the scenes with the parents or financial issues or whatever. But now everything is just so out in the forefront. I think they do need some meditation and some downtime to say woosah,
And I will say, I think there's movement to try to start doing that because, I even had some of our, there's some med students in the area that work with Ortho Virginia that are now trying to start a program where they bring in a little bit of this like basic information. They bring in professionals to do mental health and sports performance, sport nutrition, whatever else it may be, just because they're not getting it at that level. But I also think there's such a gap. I mean, you think about even like universities, not every university has necessarily like the trained professionals to do it with them yet. So, and there's obviously a huge need, like in my field in particular, trying to push more people into the field because there's not enough people to do what we do around the country. I think it's something that is coming, but I also think it's something that's going to take years to get down to the lowest levels. And I think even more so, some of the ones that need it most that are under-resourced places, those are probably the students that would most benefit from a lot of it because they may not have the extra supports to be able to access it.
Right.
I have plenty of parents from, local schools that have plenty of resources that can reach out to me and say, hey, can you work with my student? But I know we can, but it's not the students always that need it at the highest levels.
Right. Yep. Okay. I think that concludes everything. I'll turn this over to Dr. O.
Thank you for emceeing today. You did a fantastic job, so round of applause. And thank you to everybody that was on either of the panels, or all three of the panels. We greatly appreciate it. Thank you for coming out today. I know it's a Saturday, but we greatly appreciate the time, and I'm gonna let Dr. Woosterchild do the final part. And thank you to Reese.
All right, y'all. We appreciate y'all spending Saturday with us. I hope this conversation continues. Everything needs to be multidisciplinary, like we've talked about today. So I hope everyone, got to meet some new faces and make some new professional connections, and we'll keep the ball rolling. All right. Have a good one.